Well, I think the Supreme Court had this right. I think this law clearly is constitutional. I think it's also important to remember that this law is going to help us get our deficits and debt under control. The Nonpartisan Congressional Budget Office has told us that this legislation will save hundreds of billions of dollars in the first 10 years, but in the second 10 years, we'll save over $1.3 trillion. And why is that? It is because it is slowing the growth of healthcare costs. The pay-fors in the legislation grow more rapidly than does the underlying cost of healthcare. And it is also reforming healthcare in a way to move away from paying for procedures to paying for quality outcomes. Well, there are a whole series of things that are very important to people. One, it does away with lifetime limits. So if somebody has a very critical illness, cancer, heart disease, that goes beyond the lifetime limits that were previously in place, those lifetime limits no longer apply. In addition, you cannot be denied because of a pre-existing condition. That is critically important to thousands of people in North Dakota. It also does away with the donut hole that affected so many of our seniors, that was having them pay much more for their prescription drugs than will otherwise be the case under this legislation. Well, as you perhaps know, Senator Dorgan and I and Congressman Pomeroy offered legislation called the Frontier Amendment. It affects a handful of states, North Dakota being one, to get more fair reimbursement under Medicare for our hospitals and doctors. And that means $650 million to North Dakota over the next 10 years. It is hugely important to improving the quality and maintaining the quality of care in our state. So I am very, very pleased that that important provision is upheld.